16 proven methods to reduce blood sugar levels for individuals with type 2 diabetes.
Regular exercise helps muscles use blood sugar for energy and improves insulin sensitivity. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, biking, or swimming.
Managing carbohydrate intake by counting carbs and choosing whole grains over refined carbs can help control blood sugar levels. Low-carb diets have been shown to reduce blood sugar levels significantly. Some scientists say you can reduce the carbohydrate load on your body by various methods of cooking and freezing, but I have not seen significant effect of blood sugar reduction after that in my case. Fiber slows the digestion of carbs and sugar absorption, leading to a gradual rise in blood sugar levels. Foods high in fiber include vegetables, fruits, legumes, and whole grains. High-fiber diets can improve blood sugar control, but be careful about carbohydrate content listed on the packs, as sometimes they include fiber content inaccurately.
Drinking water is, well, super important. Staying hydrated helps your kidneys flush out excess sugar through urine. Drinking water regularly can lower blood sugar levels and reduce the risk of diabetes.
Managing portion sizes can help regulate calorie intake and prevent blood sugar spikes. Strategies include eating slowly, using smaller plates, and avoiding large portions. Regularly checking blood sugar levels helps understand how different foods and activities affect blood sugar. This can aid in better management of diabetes. Stress can affect blood sugar levels. Techniques such as mindfulness, meditation, and yoga can help manage stress and improve blood sugar control.
Poor sleep can affect insulin sensitivity and blood sugar levels. Aim for 7 to 9 hours of quality sleep per night to help manage blood sugar.
Losing weight and maintaining a healthy weight can improve insulin sensitivity and reduce blood sugar levels. Even a modest weight loss of 5 to 7% can have significant benefits. Diabetes, self-management education, or DSME, programs improve knowledge, self-efficacy, and self-care behaviors which, lead to better blood sugar control. These programs have shown to improve fasting blood glucose, HbA1c, and overall health status. Consuming probiotics can improve blood sugar control by enhancing gut health. Foods like yogurt, kefir, and fermented vegetables are good sources of probiotics. Some studies suggest that cinnamon can lower fasting blood glucose levels, although its effect on HbA1c levels is less clear. It may still be beneficial as part of a broader dietary strategy. 13. Magnesium supplements. Magnesium has shown benefits for blood sugar control in some studies. However, it is important to consult a healthcare provider before starting any supplement. 14. Avoiding sugary beverages. Sugary drinks can cause rapid spikes in blood sugar levels. Replacing them with water or unsweetened beverages can help manage blood sugar. Healthy eating. A balanced diet with a focus on low-calorie, low-fat foods and smaller portions can help manage blood sugar levels. This includes eating more vegetables, lean proteins, and healthy fats. These methods, supported by research, provide a comprehensive approach to managing blood sugar levels in individuals with type 2 diabetes. Always consult with a healthcare provider before making significant changes to your diabetes management plan. Based on the research findings, vitamin D supplementation appears to have potential benefits for reducing blood sugar levels and improving insulin sensitivity, particularly in individuals with type 2 diabetes. Here's a summary of the key points. Effect on HbA1c. A randomized controlled trial found that vitamin D supplementation, 4,000 IU daily for 2 months, led to a significant decrease in HbA1c levels from 7.29% to 6.76% in patients with type 2 diabetes. Insulin sensitivity. Vitamin D supplementation resulted in a decrease in insulin concentration and a non-significant decrease in HbA1c, a measure of insulin resistance. This suggests improved insulin sensitivity. Fasting blood glucose. A study on patients with non-alcoholic fatty liver disease showed that vitamin D supplementation led to a marginally significant decrease in fasting blood glucose levels. Mechanism. Some researchers believe that vitamin D may play a role in insulin production and secretion, as well as improving insulin sensitivity. Prevalence of deficiency. Vitamin D deficiency is common among people with diabetes, with one study finding that 8 out of 10 participants had vitamin D deficiency. Potential benefits. Higher vitamin D levels have been associated with a lower risk of developing type 2 diabetes and its complications, including diabetic foot ulcers. While these findings are promising, it's important to note that more research is needed to fully understand the relationship between vitamin D and blood sugar control. Some studies have shown mixed results, and the exact mechanisms are not yet fully understood. Fermented foods, particularly those rich in probiotics, have shown potential benefits for reducing blood sugar levels and improving glycemic control in individuals with type 2 diabetes. Here is a summary of the most significant research findings. Probiotic yogurt. Some studies have shown that consuming probiotic yogurt for 6 weeks can significantly improve blood glucose levels, although other studies have reported no meaningful effects. Fermented foods in prediabetes and diabetes. Regular consumption of various fermented foods, including yogurt, soybeans, and tempeh, had a statistically significant but clinically modest effect on reducing fasting blood glucose, 0.43 milligrams per deciliter, and improving insulin resistance, HbA1c. Gut microbiota and diabetes. Animal studies have demonstrated that probiotics can improve glucose and lipid metabolism, suppress glucose intolerance, and delay the onset of hyperglycemia and insulin resistance. Gut health. Fermented foods support gut health by introducing beneficial bacteria that can positively influence glucose metabolism. Alterations in gut microbiota have been linked to improved glycemic control in diabetic patients. Inflammation reduction. Probiotics in fermented foods may reduce inflammation, which is a contributing factor to insulin resistance and poor glycemic control. While the evidence points to modest benefits, incorporating fermented foods into a diabetes-friendly diet can be a part of a comprehensive approach to managing blood sugar levels. Examples of beneficial fermented foods include yogurt with live cultures, kimchi, sauerkraut, tempeh, miso, and kombucha. Fermented foods, particularly those high in probiotics, may help reduce blood sugar levels and improve insulin sensitivity in individuals with type 2 diabetes. However, the effects are generally modest, and more high-quality research is needed to determine the optimal types and amounts of fermented foods for glycemic control. As always, individuals should consult with healthcare providers before making significant dietary changes. If you have diabetes or are concerned about your blood sugar levels, it's advisable to consult with your healthcare provider about getting your vitamin D levels tested and discussing whether supplementation might be beneficial for you. Vitamin D supplementation should be done under medical supervision, as the appropriate dosage can vary based on individual factors.